Let me tell you what a SNF-ist is. It's a term which we just recently coined, almost in parallel to what I consider the hospitalist movement, where physicians who work predominantly in a hospital are now called hospitalists. In the same way, physicians who work a majority of their time in a skilled nursing facility could be considered as SNF-ist or skilled nursing facility specialist. And that's how this name or term came about. I think somebody who works in a skilled nursing facility for, say, more than 50% of their time, like the hospitalist movement, should be considered a SNF-ist, because this is an area of expertise which is growing nationwide. And I expect more and more physicians will choose this as almost a full-time profession in the future. The hospitalist model was created about 10-15 years ago. Previously, there used to be a lot of private physicians going into the hospitals, rounding in the morning, and then leaving the hospital and going and running their own private practice. The hospitals found that it was better if physicians were in the hospital 24/7, taking care of the patients, that produced less problems for the patient in the hospital. I think similarly in a skilled nursing facility, these are very sick people. And having a physician there once or twice a week is not sufficient. Having somebody available 4, 5, 6 times a week at the bedside is the advantage. So I think the skilled nursing facilities are moving in that same direction as the hospitalist movement. I was drawn to work in skilled nursing facilities, especially considering my background as a hospitalist and my training as a geriatrician. And I felt as a geriatrician in a skilled nursing facility, I could give my patients a little more time, focus more on how well they are recovering, and it gave me more satisfaction that I was actually spending time with patients, which sometimes in the hospital I did not have the time to do. And I think this is a very gratifying change in many hospitalists who would like something different to do in their careers. A skilled nursing facility would be a very attractive place, in my opinion. I think we will be seeing more SNF-ists around the country. The reason for that is the changing healthcare model. Previously, once the patient left the hospital was not truly concerned about what was going on. Now the hospitals are very focused on their bounce backs. What happens to the patient outside the hospital walls is a very major concern for the hospital, and they want the care and the transition of care to the next level to be optimum. And having physicians dedicated to taking care of patients when they leave the hospital, I think will be very important, and many health systems might start investing, like they invest in the hospitalist program, they might start investing in the post-acute skilled nursing facility physician programs.